aim in this lecture is how clinical case of COPD is presented to us, how we are going to pick particular right option that this clinical case which is presented with following investigation signs symptoms is COPD. Greetings everyone, I am Shujaat from Medicos lectures by Shujaat, and today we are going to talk about COPD. Word is showing its fate, chronic obstructive pulmonary disease. So it is a condition in which airways in the lungs become inflamed and narrowed. Ultimately air sacs also damaged. So as time being passed, breathing become difficult. So before going in roots of this topic, we have to identify how normal regulation of oxygen, how normal exchange of oxygen and carbon dioxide take place. So for that, oxygen from nose through airways, it enters in air sacs which we named as alveoli, and those alveoli they have walls, and from those walls it enters in bloodstream. And phenomena of carbon dioxide is exactly reverse. From bloodstream it enters in alveoli, and from alveoli it breathed out. We have different risk factors which contribute development of COPD. Major is smoking, either passive or either active. Second major risk factor is workplace pollutants, like if someone is working in marble factory, so there are major chance of development and exposure to different carcinogens as well as different air pollutants. So there is chance of development of COPD in those cases. And third is genetic alpha-1 antitrypsin deficiency. What alpha-1 antitrypsin deficiency do? It protects lungs from inflammation and conditions relevant to it, and basically it plays its role as anti-neutrophilic, and ultimately it protects from proteolytic activity to the lungs. So if deficiency of alpha-1 antitrypsin take place, we have chances of development of COPD. So when you talk about pathophysiology, there is 3 steps in which pathophysiology is going to be take place. Number 1 is alveolar attachment is going to be lost. Number 2 is obstruction and inflammations of airways start. Number 3, mucus production and luminal obstruction start. So from mucus production and luminous obstruction, I will drag this topic to the clinical cases, because my aim in this lecture is how clinical case of COPD is presented to us, how we are going to pick particular right option that this clinical case which is presented with following investigation signs symptoms is COPD. So for that, COPD is divided into 2, emphysema and bronchitis. Bronchitis is and cough with sputum production for more than 3 months in 2 consecutive years is bronchitis. We named it as blue blotters because their skin, their lips, they start changing color in bluish, so we named them as blue blotters. In case of emphysema, emphysema is damage of air sacs of lungs in alveoli. We name them as pink puffers because their cheeks and their skin color, particularly in face, start changing to the pink for time being, and patient presented with dyspnea and barrel chest. And for investigations, we have pulmonary function test as a key, and force expiratory volume, and force vital capacity. Expiratory volume is number or amount of air which we breathe out, and the values is basically 70%, and if it's less than 70 or less than 60, so we have chances of development of COPD. Chest X-ray, it shows us hyperinflammatory condition of lungs. CT scan to diagnose emphysema, ECG for pulmonary hypertension and arterial blood gas. So that's how we diagnose. Now when we discuss clinical case, they will give us clinical case like that. A patient is presented with dyspnea, with barrel chest, and it also have an inflammatory obstruction of airways with either they will give force expiratory volume or force vital capacity, and they will give their values in abnormal, and so we are going to pick this option that this particular condition is COPD. Either they also going to tell us if examiner is kind to us, so it's also going to tell us about risk factors as well. Now when we talk about management, so management is include SABA and LABA, and short acting bronchodilators, long acting bronchodilator, muscarinic antagonist, as well as corticosteroids like formoterol, salmeterol, and theophylline in case of when discuss corticosteroids. And muscarinic antagonist, what they do, they basically play their role in constriction because dilation occur, so they constrict. And after that we have surgical interventions if that management will not work, because management is of two kinds, one is pharmacological and one is non-pharmacological. And in non-pharmacological we use oxygen therapy, and we use different methods to protect from pollutants, as well as if these managements didn't work, we have to move towards surgery, which is single lung transplant, lung volume reduction, or bilectomy, which is removal of bulla. Bulla is basically a 1 centimeter, or you can say 1 centimeter diameter dissection of lung because damaged area. So that's how we basically treat, we basically suspect condition patient of COPD. So that's all from today's lecture. So hope you all guys will understand it well. In case of any query, you are more than welcome. My number is mentioned in channel as well as page description. I just request you that don't forget to subscribe Medicos lectures by Shujaat. Thanks so much guys.